Hello students. Continuing with the hospital census, so there are certain things, certain terms that we should be very much familiar with. The first term is bed count per day. So bed count, when we see this term bed count, that means the number of beds. So per day means every day we do this bed count per day. So when we say bed count per day, it means it is a unit of measure which denotes the presence of an inpatient bed, occupied or unoccupied, set up and staffed for use in one 24-hour period. So in a per day, it tells you bed count per day means how many numbers of beds are available, out of which how many are occupied and how many are unoccupied bed. So this is very much important for any hospital administrator to know, so that you can really move your operation in a very smooth way. You know which beds are available, how many beds are not available, where which patient can be shifted to which ward or which bed, so that the maximum use of human resource is also there, and the wastage of human resource is also minimized. We have to see that the optimum use of resources, the operational resource or maybe equipment resource is also optimal. So in order to remove any wastage, so you have to know what is the bed count per day, how many are occupied and how many are unoccupied. The next term is census. We have already discussed in the previous video regarding the hospital census. We know it is a count of inpatient at any given point of time. So, sometimes the hospital, majority of the hospital, what they do is that they take the census at particular given point of time. However, you can even take 2 times a day. Like for example, daytime 12 noon, that you are calculating the hospital census, and also about the midnight. So it depends upon the hospital policy, of course. So this is the particular the time is being fixed. Okay, so the census is always taken in a hospital at the same time each day, usually midnight. So the next is the daily census, that is the daily inpatient census. The daily census is the number of patients present at census taking time, plus any patient who were admitted after the previous census taking time and discharged before the next census taking time. So the time period between the census that you have taken, like for example, if 12 midnight you have taken till tomorrow 12 midnight, so between that time how many patients were discharged, how many patients were admitted, so that period, so those patients who are admitted after the census taking time, and those patients who are being discharged after the census taking time, so that is known as the daily census, right? So this is the daily inpatient census. So all of together, you can understand that these is all the number of patients or the inpatient that we are taking into the scenario. Now the next concept is the hospital patient. So what is a hospital patient? So an outpatient or an inpatient to whom a hospital provides comprehensive care, including all necessary medical, nursing and diagnostic services, and if they are available at the hospital, dental and allied health services by means of its own staff or by other agreed agreements. So hospital patient is any patient, it can be an outpatient, it can be an inpatient, or it can be a patient who is taking treatment in their own home, and maybe you are sending a physiotherapist to give them a physiotherapy session. So they are all a hospital patient, because the care that the patient is getting, that the comprehensive care or the diagnostic care or medical nursing care, whichever the patient is getting from the hospital side. So whoever you are delivering the service to, those patients are your hospital patients. So it doesn't mean that you have a patient at their home, and the patient is taking some kind of medication under a doctor from your hospital, but the patient, since they are taking the medication in their home, they are not termed as hospital patient. No, it's not like that. They will also be termed as your patient itself. Those patients who are in your daycare center, those patients who just come in your hospital for maybe half an hour, 1 hour, take a consultation and go back. So they are all your hospital. They are all termed as a hospital patient. So it can be any patient, right? Emergency patient, OPD patient, IPD patient. So anybody who's taking your health services or whoever you are providing your care, those are all hospital patients. So thank you. So we'll be moving to the next slide in the next video. Thank you so much.